God bless you. This is your coach and colleague, Dr. Brenda Bowers, with Because We Are in the World segment today. The update on COVID-19 in the state of Wisconsin, county of Milwaukee, city of Milwaukee, and then we look at that global look through our colleagues at Johns Hopkins University that provide this incredible database that we look at on a daily basis. Listen, we really have to get this stay at home, safer at home down pat. It's brand new territory for everyone, but what we do know at this point is COVID kills. And we want to make sure that we are the ones carrying the cure, that we are not subject to continuing to watch the negative impact that this particular virus is having on the world. The only way a virus can have this type of impact is because it's being spread from person to person via different modalities, where there's touching of hands, hands touching face, hugging, kissing, talking, walking by a room where someone was at, coughing, sneezing. We're not even sure yet the length of time that this virus lives. But what we do know is that if we minimize and eliminate transmission by using excellent cleaning habits, and remember, sanitize yourself before you say something to somebody else. Don't be mean, just be clean. It's important for us to be cleaner than we've ever been, starting with ourselves and being very conscious of how we may be transmitting a virus that is taking lives that are very productive, people we love very much. So let us be intentional and deliberate and not just seeing numbers, but making sure that we are being accountable. World Changers and Difference Makers is all about self-transformation so we can mend the world one sphere at a time. We do that by making sure our AAA policy, it's always paid in full. And what is AAA? Always accountable, always. Your policy is in force and is paid in full. You are always accountable when? Always. AAA. We need to make sure that we are accountable to ourselves, our loved ones, our communities, our society, our world. If each of us would be accountable for ourselves and manage ourselves in a way that we are minimizing the transmission of any microorganism, then we have the opportunity to stop so many of these bacteria, fungus, viruses, all of this. We can minimize transmission of anything that can overgrow in our system and create an infectious environment or a fertile environment to spread and become from normal to pathological that needs some type of medical attention. But we must, before we look out, let's look in. That's my preaching platform today is AAA policies are in force. They are paid in full, always accountable, always, starting with you. So let's see what's happening in the world of Wisconsin. Today, April 9th, 2020, the total number of positive cases has risen to 2,885, and 843 of those have been hospitalized, hanging at that 29% number. 31,424 people have tested negative, and we're over the 100 mark in deaths in the state of Wisconsin. We're at 111 based on the state data, but then I'm getting ready to show you data where we know the state has some lagging in its data, and our source of truth is always closest to the truth. So we look at county data, we look at data from the municipalities to really see where the accuracy is, and it fleshes out over time. So as we consider how that plays out in the state of Wisconsin, I'll show you what that looks like from our colleagues at Fox 6 here in the Brown Deer area, the state map that they put up, and then you'll be able to see the numbers that they are using versus the numbers that the state has. So I'm going to show you the map of the state, which is going to show you the breakdown at a city level. I'm going to show you the numbers from the state. Then I'm going to show you the county dashboard. And then I'm going to show you the global dashboard from our colleagues at Johns Hopkins University and Medicine. So that way, when I flip my screen, you'll know that we're going to look at all of those while I'm talking versus us going back and forth. All right, let me flip and let me show you. So the first thing is here where we have the map of Wisconsin, and you can see 2,973 cases and then 115 deaths. And this is showing us where those deaths have occurred of the 115. And it's also showing where the confirmed cases are. And we see this huge number here, 1560. So let's go ahead and look at the Milwaukee County portion of that. So when we look at Milwaukee County, you can see here in that upper left-hand corner that in the county of Milwaukee, there have been 1,560 confirmed cases. And in that bottom left corner, we see that cumulative positive case count, and it's still going up. We're not getting that curve that we want yet. It is still increasing, and that's what we want to make sure we are attacking. In the middle, you see the racial stratification, and in the county of Milwaukee, you have 692 of the confirmed cases are Black or African American, 407 are white, 392 don't respond to the race question, 24 Asian, 8 multiple race, 6 American Indian, and 3 Native Hawaiian. So that gives us the racial stratification of the confirmed cases. And then we have the 68 deaths. So here, again, when we're looking at that number of 115 deaths, 68 of them are in the county of Milwaukee. And we also see here where they have the stratification of race in Milwaukee County. Of the 68 deaths, 45 of them are Black, African American, 20 are white, 2 Hispanic, and 1 multiple race. And here, when we look at cumulative deaths by the day, we do have a little better starting to curve, and then we're going up a little. So it's not as steep as over here on the left, but it is still letting us know that we have a long way to go. So I'm showing you this middle stratification again on the left, where we now are looking at the age stratification of the data. What is very interesting about the age, how the age is playing out, is there was a time when we looked at this data just a couple of weeks ago that we could with confidence say that these were people between 50 and over 80. But now look at that data. You have 0 to 9, 4. You have 10 to 19, 17. 20 to 29, 158. 30 to 39, 207. 40 to 49, 260. 50 to 59, 298. 60 to 69, 301. 70 to 79, 198, and 80 and over, 117. However, when we're looking at that, you see how that has more of that hump that we're looking at, meaning, so I'm putting my finger on the data screen, it's making more of that curve. That curve is what we want to see these do. But what we don't want to see is the impact at all of those ages. So then when we look at what Wisconsin is saying, and I do wait to give you this information until after 4:30 when the state and the county both say they have put in their final data for the day. So you see the lag data, as I told you. So our source of truth is always closest to the truth where the information is reported from. So in Wisconsin, if you go to the Wisconsin database and you say, well, the news said it was 115 deaths and this says 111, the state already discloses to you that they are a lag indicator, and they do a great job actually of pointing out that if you want accurate number, then go to what you're looking for. Go to the county that you want the information from. But it does catch up over time. But if you go to the state website today, what you're going to see is this 31,424 negative result, 2,885 confirmed positive, 843 or 29% hospitalized, and 111 deaths. Still 111 more than we want to see. And then our global database, which is the last one that we look at, which is the fun one for me. I enjoy looking at the Johns Hopkins, and I always update it for you right before we look at it, because it's amazing. We have 184 different countries or regions that report. And the United States, where it gets harder to follow this as accurate data for the United States, is we report city by city on the death side, and then we have a roll up on the confirmed cases and on the recovered side. And I've shown you that on a daily basis, so I know you're pretty much up to speed on that. So today that number is now 1,582,904 confirmed cases. Coronavirus COVID-19 cases confirmed, over 1.5 million. And you see the number one leading country, region, sovereignty is the United States. So of that 1.5 million, the United States is carrying 454,304 of those confirmed cases. Remember when we first started this, when we looked at the map of the United States, you could see a lot of gray, and now we're pretty much covered in red. Different than any of the other countries. The close second to us is Europe when you look at the red that's over here. So the total number of deaths, 94,807. And remember here, this is where we can scroll down and we can see different cities in the United States. Hartford, Connecticut, Broward, Florida. So you see Milwaukee, Wisconsin, they're showing 59 deaths in the city of Milwaukee. So, excuse me, that's something that fell off my counter. So we'll look, I'll go back to that county data and click on the city and see how we're syncing up. And then total recovered, 351,201. And the United States is at 2,4, the 6-1 down today at 24,962 that are considered totally recovered. But what we see, unfortunately, and what we know we have the power to stop, is this up number, and is continuing to climb. So Milwaukee has this 59 number of deaths. So let's sync up the data. Sorry about that. Let's see. Where did I just hit something and close that out? So let me go back to my, it's quickest for me to get it at the Fox 6 It was interrupted. Yes, I was interrupted. I love that we just do this real time so you can see what's happening. And if you want to do it, then you see I go to coronavirus. Let's go down to the map. And we go down to the map. That's the quickest way to get to the county data. So now let's go back to the county data. And when we go back to the county data, I want to go to the city. Well, actually, before we go to the city, we can look right here at the male, female, because remember we did look at that before, and I wanted to help you have your talking points around the difference between the gender stratification in confirmed cases versus gender stratification in number of deaths, because it's not the same. So the confirmed case, in the confirmed cases of the 1,560 in Milwaukee County, you have 833 that are female, 727 male. So a propensity that the confirmed cases, there are more female than male. When we scoot over and we look at deaths by gender, then we have females 27 and males 41. So there's a much more significant occurrence of male gender dying from COVID-19 than female. So you have to just know what you're hearing. Confirmed cases, females lead, deaths, men are leading, and it's a broader gap when you look at the deaths versus the confirmed cases. And then lastly, I want to show you the city. So remember that 50 some odd number that we saw on the global data. Here, what this is showing us, the confirmed cases by municipality. Of that 1,560 confirmed cases in Milwaukee County, 1,200 of those are in the city of Milwaukee. So when we see that, and it did not give us that same on the death side. So